Hi, I am Mr. Rosain, intern doctor of Medicine Medical College. In this video, I demonstrated you the examination of the respiratory system from front. From front, we just started our examination with inspection. In inspection, we see shape of the chest, movement of the chest, any sign of dyspnea, is there any gynecomastia, pigmentation, and hair distribution. I just demonstrated you the movement of the chest because it is commonly mistaken thing in exam. So how you inspect the movement of the chest? For movement of the chest, you have to remove the pillow from the head and then observe the chest movement from the toe end. Observe the symmetry of the movement and is there a restriction of movement in any side, left or right side, and observe the symmetry by your eye level. So after inspection and then you go for palpation. In palpation we see four things. First of all we see position of the trachea, then position of the apex beat, then go for chest expansibility, then go for vocal fremitus. And we just started our examination with position of the trachea. For examination of the position of the trachea, you have to remove the pillow. Use your right hand, use your index finger and ring finger. By using your index finger and ring finger, you just put these two fingers over the end of the clavicle, just like this, end of the clavicle. And use your middle finger and observe the position of the trachea. Observe the position of the trachea. In normal person, it may be slightly shifted to the right, and then you go for finding the apex beat. Let your hand over the precordium, just slightly left lateral the patient. Measure the intercostal space, second, third, fourth, fifth. Measure by your tape from the midline. I get here about 10 cm from the midline. And after examination of the position of the trachea and apex beat, then you go for chest expansibility. For examination of the chest expansibility, we examine chest expansibility above the nipple, at the nipple, and below the nipple. Just hold like this. Bubbore shasana. Bubbore shasana. At the nipple and below the nipple. So we see above the nipple, at the nipple, and below the nipple. And then you go for vocal fremitus. For vocal fremitus, you ask the patient, আমি যখন আপনার বুকে হাত রাখবো তখন তিন তিন বলবেন। তিন 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 তিন। Just like this, you have to do 3 set. 1 set, 2 set, 1 set. Compare each side. 1 set here. 1 set here and 3 set here. 1 set, 1 set, 1 set. So 3 set here. So 6 times. You just 6 times. 3 3 3 3 3 3 3 3 3 3 3 3 3 3 3 3 3 3 3 3 and 3 3. So you just see the vocal fremitus, and then we go for percussion of the chest. For percussion of the chest, we have intercostal spaces. You see I write down here. First, you percuss over the clavicle. First, you percuss over the clavicle and compare side by side. Then intercostal spaces. First, second, third, fourth, fifth, and 6 intercostal space. You just percuss over the clavicle and then 6 intercostal space. 7 times percuss over here, and then percuss in the mid axillary line 4 times. So we percuss here 7 times and here 4 times. And at the end of your percussion, you just have to measure the upper border of liver dullness. Don't forget this. At the end of percussion from the front, you have to measure the upper border of liver dullness. Just like I found it in the 7 intercostal space. You just studied it from the 6 intercostal space. You just studied it from the 2nd intercostal space. Second, third, fourth, fifth, 6, then 7 intercostal space. I just get here in 7 intercostal, usually found in the 5th or 6th intercostal space. And then we go for auscultation. For auscultation of the chest, you have to put your stethoscope and then ask the patient, ha kore lomba lomba shas niন. Ha kore lomba lomba shas niন. And then you examine them by use your bell, put over the intercostal spaces. First space, then second space, then third space, then fourth space, fifth space, and sixth space. Avoid auscultation in the 3 cm in the midline because center. Avoid auscultation in the 3 cm from the center because it transmits bronchial breath sound. You just auscult in the 6 intercostal space. 1, 2, 3, 4, 5, 6. 6 intercostal space. In the mid axillary line, you have to auscult in 4 areas. 4th, 5th, 6th, and 7 intercostal space. Compare it side by side. Compare it side by side. You auscult for, remember, you auscult for breath sound, added sound, and vocal resonance. For examination of the vocal resonance, you ask the patient. আমি যখন এটা আপনার বুকের উপরে রাখবো তখন 3 3 বলবেন 3 3 3 3 3 3 3 3 3 3 3 3 3 3 3 So we just do 6 here and 4 here. So at the end of your examination, you have to present your case. You have to present your case like this. On my examination of the respiratory system, on my inspection, the shape of the chest is normal. Chest movement is normal. There is no sign of dyspnea. Gynecomastia is absent. Hair distribution and pigmentation is hair distribution normal and pigmentation is absent. On my palpation, trachea is centrally placed. Apex bit placed in the 5th intercostal space, 9 cm away from the midline. And then chest expansibility is normal and vocal fremitus is normal. On my percussion, the percussion nose is resonant all over the chest. And on my auscultation, the breath sound is not vesicular and there is no added sound. And vocal resonance is normal. You just end your examination like this. So this is all about examination of the respiratory system from phone. Thanks for watching.